PACE-A trial is a randomized phase 3 study comparing SBRT or stereotactic body radiotherapy to surgery for intermediate risk and low risk localized prostate cancer. It's important to have randomized data because it's the highest level of evidence we have. Randomizing between surgery and any form of radiation treatment is extremely difficult and historically has been difficult to recruit to these studies. So this is the first, to our knowledge, and probably the only randomized trial which has compared robotic-assisted radical prostatectomy with SBRT. And I think, therefore, it is important and the results are highly significant. PACE-A had two co-primary endpoints, the first being urinary incontinence or pad wearing at 2 years, and the second co-primary endpoint was epic bowel bother at 2 years. We expected that bowel bother would be worse with SBRT and that continence would be worse with surgery, and that is what we found. So for continence, for SBRT, 4% of patients wore a pad at 2 years, whereas 46% of patients in the surgery arm. However, for bowel function, there was a greater degree of bowel bother for SBRT. With EPIC, the maximum score you can have is 100. For surgery, it was 97.5. And for bowel bother for radiotherapy or SBRT was 88.7. So the significance of the findings of PACE-A, I think, are that we can now have better information to discuss with patients when they are choosing which form of radical treatment to have. I think it's important to note in this cohort of patients with radical treatment, most of these men are not destined to die of prostate cancer. So therefore, their quality of life following treatment is extremely important. And we now know that there is a difference between the two modalities. There was also a difference in sexual function. So for sexual function, an EPIC score of 100 is the maximum you can have. For surgery, the score was 27, and for SBRT, it was 57. So it was highly statistically significantly different. Much better sexual function with SBRT than surgery. I think for men, they should be given the information that we've presented in PACE-A so that they can make an educated and informed decision whether they want to proceed with surgery or opt to have treatment with SBRT. Well, the next steps, we'll see how PACE-A is adopted. I don't think there'll be a further randomized study between surgery and SBRT. We have other studies which are now running, so PACE nodes, which is in higher risk prostate cancer, and there are studies looking at reducing fractionation from 5 down to 2. The PACE-A trial results will be published in the next few months. The current first draft of the paper is being written.